There we go. I didn't hear that little announcement. Thank you, Ayana. So, for today's program, we are thrilled to partner with the Center on Addison, Equality Illinois, Golden Rainbows of Illinois South, and our Out Aging Committee. I also want to state that no federal funds were used to produce this program. During today's program, you're going to hear from Senator Lakesia Collins about her commitment to supporting older adults who identify as LGBTQ and or are living with HIV. You'll hear from Timothy S. Jackson, my colleague in AFC's Policy and Advocacy Department, who will discuss advocacy efforts to support an LGBTQ and HIV long-term Bill of Rights. Then we'll hear from Commissioner Don Bell, who will provide a brief update on the Illinois Commission on LGBTQ plus aging and long-term HIV survival. And he will be followed by Michelle Hoersch of the Illinois Department on Aging, who will give us an overview of the soon-to-be-released Illinois Multi-Sector Plan for Aging. Ray Kaufman, a graduate of Pat's Storytelling for Change training, will share a personal story about growing older and home. And finally, our Economics of Aging Challenges and Opportunities panel will feature remarks by Diane Slezak and Elizabeth Durkin of AgeOptions, Starr De La Santos of Women Employed, and Naya Kelly of the Chicago Coalition to End Homelessness. And that panel will be guided by Billy Rogers of Golden Rainbows of Illinois South. We will have the full bios in this document, put in the chat rather, because we don't have time to do long intros of our wonderful speakers because there's a lot on this agenda, as you can see. Please feel free throughout the program to put any questions you have in the chat. We'll try to answer them in real time, but if we don't get to them, we will provide responses in our follow-up email a day or two after this program. We'll also include any links and as well as the slide decks. Let me slow down. One more thing, we're using the meetings version of Zoom as requested by folks who have attended our programs before. So please, please, please remember to put yourself on mute. Otherwise, everyone will hear everything that you are saying. Also, when you speak on Zoom, it's kind of hard to feel the audience. So feel free to use the reactions and show some love in the chat for our speakers. And now let me just check. There's so many of you on here. I've got to use multiple screens. Is Senator Collins on? Can my colleagues help me out? Is Senator Collins on the call?
I didn't see her name come up, Kim.
Okay. We're gonna do a little loop-de-loop then. So we'll switch out from Senator Collins. We'll instead move right to Tim. And if she joins us afterward, whenever she joins us, we'll make sure that she gets to speak.
Yeah, absolutely. Thank you so much. Good morning, Kim, and thank you all so much for joining us for this morning's forum. This is really kind of the power of pivoting in action. And so this is what we do here. Again, I'm just going to talk to you. Timothy Jackson, pronouns he, him, Senior Director of Policy and Advocacy for AIDS Foundation Chicago. And I'm going to talk to you all this morning very briefly about the LGBTQ plus and HIV long-term care Bill of Rights. According to the groundbreaking policy report released by our national partners at SAGE and AARP Illinois, called the Disrupting Disparities, Challenges, and Solutions for 50 plus LGBTQ Illinoisans, that was released back in 2021, LGBTQ folks and people living with HIV have long faced unique challenges as they age because of the lack of affirming resources and services, stigmatization, including in long-term care and home-based care settings. And so these populations, LGBTQ older folks and Illinoisans aging with HIV, are a key part of the state's rapidly growing elder population. an estimated a little over 122,000 LGBTQ plus individuals are age 50 and older, live here in Illinois. That's about a quarter of all LGBTQ Illinois adults. And then we know that the number of people age 50 and older living with HIV in Illinois is about 49% of the total number of Illinoisans living with HIV. And that mirrors really the numbers that we see nationally, where people living with HIV over the age of 50 ranks about 50, 51 or so. And so you may say, well, why is that important? It's because these communities have often sometimes been ignored, seem invisible. But the thing about that is these populations are also growing rapidly. And so how do we pass policy solutions that are attuned to their needs, to these populations' needs, and especially as they continue to age, right? We understand that just on a given day, you deal with things as you continue to age, and those things are compounded if you're a member of both the LGBTQ community or a person aging with HIV. And so we want to be very attuned to that. And so what's the policy solution? The policy solution is the Illinois LGBTQ plus and HIV long-term care Bill of Rights. As I mentioned, older adults who identify as LGBTQ plus and are living with HIV are more likely to rely on institutionalized settings, such as nursing homes, home health, assisted living. They rely on these type of settings for care because they oftentimes lack adult children or other family members who can provide informal caregiving. A lot of times in these communities, we talk about the chosen families, right? And then we understand that HIV-related stigma and discrimination, LGBTQ stigma and discrimination, homophobia, transphobia, all of those are a real thing and a real threat to these communities, especially in these type of facilities. And then finally, we understand that as this community continues to grow, these communities continue to grow, that the staff at these facilities, these long-term care, home-based care facilities, are not always clear on how to provide respectful and affirming appropriate care to these growing populations. And so that is the reason why this is needed. And so essentially what this legislation would do that we are looking at running during the 2026 spring session of the Illinois General Assembly would make changes to several current statutes related to Bill of Rights in these type of settings. And so we would be doing that, and we would also mandate cultural competency training for LGBTQ folks and people living with HIV for that staff in these type of settings. And so that's essentially what the bill would do. We are proud to announce that we have secured sponsors for this legislation. In the Senate, our chief Senate sponsor will be Senator Selena Villanueva, who has been an absolute rock star on a number of issues, that we have worked on from, the bill that we passed, I want to say 2 years ago around gender expansive multi-stall restrooms. She was the lead Senate sponsor there. She was the lead Senate sponsor on the state legislation to codify gender affirming care in state law after the overturning of Roe versus Wade. So she has been a stellar champion on this side. And on the House, we are going to be looking to Representative Nicole Grassi, who is new to the General Assembly, but not to taking care of people most vulnerable, including people living with and aging with HIV. Her career has been built on as a chaplain at the height of the AIDS epidemic. And so she understands exactly what these communities need and deserve. And so we are so excited to have them as our lead champions. I'm not exactly sure if she is on just yet, but Senator Lakesia Collins just yesterday has agreed to be one of our Senate chief co-sponsors. We know that to get this legislation passed is going to require a whole team of folks. And so she has already signed on to be a part of that team. And I see so many people from the coalition on this morning that have been doing the work and getting us ready for 2026. So I'm going to stop talking for just a moment. If your organization is on and like, hey, I'm interested in this, we would love to be able to sign on in support of this. I'm going to play something in the chat, and it's a simple Google sign on form. And then that way you can get linked. Just fill this form out and you get linked, and your name will appear on the fact sheet, and you'll find out more information about this policy issue as we begin the 2026 session in less than a month.
Thank you, Tim. And Senator Collins is entering the waiting room. So thank you for allowing us to do that pivot. All right, I want to give her a moment to settle. Senator Collins, are you on?
Yes, I am on now, and I do apologize. It is
No,
hard getting on here, so I had to get on from my browser, and I'm like, oh my gosh, wait a minute.
that's okay. We had you. Tim spoke,
Oh,
and now we are happy to have you on the line. And Tim gave you a lot of praise and a lot of love. So
aw,
we will turn it over to you at this time. And thank you so much for being here with us.
thank you for having me. Can we go now?
Yeah. Are you able to turn your camera on? And if not, that's okay.
No, not right now.
We're just glad you are here.
Oh my gosh. But Kim, thank you. Um, and I'm happy to be here. And Tim is just amazing. Fierce advocate, and I am so happy that we have him in Springfield. What I would say about the Bill of Rights is that I am happy to say that I am going to be a chief co-sponsor. For those that don't know, I worked in healthcare for about 11 years. And so I worked on a memory care unit, but I also worked on an independent unit. And just from my personal experience, I've worked with um, our elder population who, identify as LGBTQ plus. And I also dealt with our elder population who had HIV. And I was thinking about this one resident in particular who was both LGBTQ plus and had HIV. And I remember I was about like maybe 23 years old at the time. And I remember just witnessing how this resident was treated differently and comments that was made. And I personally did not know this resident's status, but there were comments that were being made. And this resident was very vocal about, you know, her status. But um, there wasn't a lot of training or conversation around how to interact with her culturally or you know um like just like just any type of training on how to de-escalate situations where she was not her best. And so I grew a really good relationship with her. I found out a lot of information about her, and I would just report or confront some of my colleagues, because I felt like it was just the right thing to do. And what I will say is that, when you don't know, you don't know, but it's also dangerous because, most times she would convert back to, being like quiet, kind of isolated. And when I would talk to her, I would find out she's just hurt because she felt like she had to go back into the closet. She felt like she was being discriminated against because of her status. She really didn't want a lot of people to know about her situation, but she had an incredible story. And, I just carried that with me, and I thought about that when I thought about this bill, right? And then I started thinking about, other settings that I've been in where there have been workers who just, I don't think it's intentional, but it's just that they were very naive, to the situation, which also can still cause harm to a resident who really rely on these institutions for assistance. And so, because I love the work that I did as a healthcare worker, I still carry that as a legislator. I still think about, some of those different those situations that took place, and then I apply it to the policies that I've been able to carry in the past and now. And I just feel like this is very important legislation. I think sometimes people don't even think about things like this, but that's why it's so important to have advocacy, fierce advocacy groups like you all, that are literally like, folks with lived experience, but also just thinking around the clock of like, how do we protect every person in this space. And so I'm just proud to be a part of this. And thank you all for having me on.
And thank you, Senator Collins. I think this is an example of someone who's been our ally even when we didn't know her name. So that's the kind of allies we need. Thank you so much for being here with us. We know you're a busy, busy person, and the fact that you've made the time to talk to this group means so much to us. And the fact that you are chief co-sponsor for this bill also means so much to us. So we know success is around the corner when you're working on a bill with us. Thank you, thank you, thank you.
Thank you, thank you.
And feel free to stick around as long as you want. We will be here until 10 o'clock.
Okay.
And now I'm going to turn things over to Commissioner Don Bell to talk about another institution related to an important bill that Senator Collins helped get passed a few years back.
Exactly right. Good morning, everyone. My name is Donald M. Bell. My pronouns are he, him, his, and I'm 76 years old. And I have the honor of serving you and the people of the state of Illinois as the chairperson of the Illinois Commission on LGBTQ plus Aging and Long-Term HIV Survival, part of the legislative legacy of Senator Collins and other supportive members of our legislature. I do want to note that ours is a very unique commission amongst the 50 states because it was legislatively established, and it owes its nascence to a similar commission established about 10 years ago in the Commonwealth of Massachusetts. But we have an opportunity here in Illinois to meet our long-term historical legacy in Illinois. This is a very important state, a very important place with its legacy in the community dating back over 100 years ago to the founding of the first LGBTQ homophile organization, to being the first state to decriminalize homosexuality, up to and including the establishment of this commission. And we're very proud to be a part of that tradition. Now, rather than spending a lot of time talking about what we're doing, we're actually proud to announce that the length of time that this commission is going to serve has just been extended by a year. And what we are doing is looking forward to providing the opportunity for more of you to come and join us. We need those of you who stand in advocacy for the LGBTQ plus aging community and longtime HIV survivors to come forward and serve with us in meeting the needs of that community. Now, we're looking for people of lived experience. We're looking for people who are members of the community, but also people who are allies to the community. We certainly do not intend to discriminate on the basis of sexual orientation and gender identity when it took so long for us to achieve equality in those areas. So we're looking for members of the commission who come from, who are geographically differentiated, who come from downstate. We have strong representation from Southern Illinois is represented by Billy Rogers and Golden Rainbows of Illinois South. We have strong participation in central area around Springfield is represented by the area offices on aging, actually in suburban Cook County, Springfield, and also down south in Little Egypt. But we're looking for people from all across the state. We are a state of 102 counties, not just Cook County. So we don't want to geographically discriminate because the bulk of the population lives in Cook County. In addition to that, we want to have our underrepresented communities. We need more participation and advocacy for the trans community. We, here in Chicago and in Cook County, we print ballots in 4 different languages. We print ballots in Chinese, and yet we are underrepresented for the Asian community. We print ballots in Polish, and we are underrepresented for the migrant community. And we print ballots in Spanish, and we are underrepresented for the Latinx community. So please take a look at what the link that's posted in the chat, inviting you to apply to become a commissioner and help us as we go into this, what we expect at this point to be our final year, where we're continuing to outreach and represent and advocate for the aging and survival community. Thank you so much. And now I'd like to pass it along to my colleague from the Illinois Department on Aging, Michelle Hoersch.
Good morning. How are you all? It's so good to be here. And Commissioner Bell, thank you. Thank you for handing it off to me and for your really interesting remarks. And I'm excited that the commission is going to be extended for a year, because I'm eager to work with the commission and everyone else as well, but the commission in particular, to help inform and support the implementation of the multi-sector plan on aging. My name is Michelle Hoersch, and I am the Chief Planning Officer for the Illinois Multi-Sector Plan for Aging. I am delighted to be here to talk to you today about the plan that is not yet released, but is very close to that. It's due to the Governor and General Assembly by the end of the year. And I will, without ado, just jump in because we have limited time and lots to cover. So the mission of the Illinois Department on Aging, of course, is to serve and advocate for older Illinoisans and their caregivers for older Illinoisans and their caregivers by administering quality, culturally appropriate programs that promote partnerships and encourage independence, dignity, and quality of life. And I seldom read directly from slides, but I think this one is worth a word-for-word reading. It really highlights the person-centered programs, culturally appropriate services, and the advocacy and education of the department, which really is a phenomenal foundation for the Illinois Multi-Sector Plan on Aging. So I'll just quickly go through what the plan is, and then I'll get into more detail about what it means really, I believe, for the people, or why it resonates for the people on this call. The plan is the governor's response to recommendations from the Illinois Aging Together Coalition. It's which included representation from all across the state, lots of stories and input from folks all across the state about what were the assets of aging and what were the challenges in terms of services and structures and systems. And it is a multi-sector plan for aging. It's a 10-year blueprint. The first multi-sector plan was from California, and then Massachusetts jumped on board. We are now in the first wave. We're the 12th state to really dive in and begin the implementation by having almost completed plan. And more states are getting on board every day, which also provides a really terrific opportunity for us to collaborate across states and see what's working from one state to the next, and how people should pivot if needed. The plan establishes priorities, policies, and programs related to aging, and it is a partnership and collaboration. Those are really the key. When it says multi-sector, it means multi-sector. This isn't just the Department on Aging. This is the Department on Aging in close personal collaboration with almost every department in the state of Illinois, as well as so many entities external to the state government. It also challenges us to reframe how we think about aging and combat ageism as one of the many isms that we need to combat in our society. And so I think the reframing aging is a very important part, because so unintentionally, and I think as Senator Collins referenced, that people mean well. They just need the training. We need to train providers and train ourselves for things that can be harmful, and what the small pivots can be to change our paradigm that can be very helpful. And so we never want to do anything, as the senator described, that is discriminatory, that may cause people to have feelings of needing to go back into the closet. And the one thing that Director Killow said from the moment, my first interview with her, and pretty much every day since, is that equity and inclusion needs to be embedded and actualized all throughout this plan. And we believe that it is. There are 4 focus areas, and I'll get into slightly more depth about these. The focus areas include creating livable and connected communities, ensuring health for all ages, investing in caregiving, and affording aging, which, I'm hard pressed to think of things that don't fall into those categories, but I really like the organization. I was handed this framework when I started back in June, and there's nothing I would change about it. I think these are very logical areas in which to collaborate and to base the work. So a little more about creating livable and connected communities. We're looking at both the physical infrastructure as well as the social infrastructure. Within the physical, it's age-friendly neighborhoods, making sure that there's housing security and homelessness prevention. There was some really devastating NOFO that came out of the Department of Housing and Urban Development that's really going to radically, if operationalized, and probably will happen, radically impact the ability to provide housing services. And so we're working in a really constantly changing climate. And so this plan is also needing to pivot and needing to adapt to the realities of new legislation, to financing, et cetera. We're also looking, of course, at transportation, and with respect to social infrastructure, and making sure people are connected. Connection and loneliness are 2 opposite ends of the spectrum, and we need to move people towards social connection because we know that is so much healthier for them. With respect to ensuring health for all ages, the second focus area, we focus on promoting and preserving health, and that includes prevention and health promotion, health care for older adults, making sure care is accessible, coordinated, that health professionals, and there's good education for health professions on aging and all aspects of aging, as well as hospice and palliative care, and a huge focus on expanding the workforce. With respect to caregiving, we all, as Timothy said, we have our chosen families, we have our families, we have our chosen families, and caregiving is a huge issue for individuals, and being a caregiver and being cared for by a caregiver. So there's a lot of attention, thanks to Diane Slezak and so many others who were really at the forefront of pushing to ensure that caregiving was well represented in this plan, and I believe it is. We look at improving information and training for caregivers, looking to provide respite care, figuring out how to provide and give access to a knowledge of financial resources, peer support, and really economic security, because somebody shouldn't have to choose between caring for a loved one and their economic future. Which brings me to affording aging, which is the 4th focus area. And we're really looking to try to support programs, policies, structures, and not just support, but build them as we go along, that facilitate aging in place or aging in community. And also looks at funding and availability of home and community-based resources, a central part of what the Illinois Department on Aging does, access to affordable housing, as we've described, financial knowledge, confidence, and preparation. So few people, myself included, really know about all the services that are available. In fact, a friend of mine last night called me and said, do you know anything about senior tax freezes? And so really trying to make all that information very accessible to everyone. And retirement savings, promoting that, and also not getting out of the way of folks who want to continue to work as they get older, but because there are limitations on their benefits if they do, we want to see if what we can do in that space as well. So as I believe I'm quoting Commissioner Don Bell on this one, older adults hold multiple identities. And if he wasn't the one who came up with it, well, I'm crediting him for it here because that's why I titled this slide after a recent conversation. The Illinois population is getting older and it's getting more diverse. We have more older women, more people of color, members of the LGBTQ community, individuals with disabilities, folks who are justice involved. The rural population needs particular attention, and individuals with lower income. And the LGBTQA plus community is well represented and referenced throughout this plan. And I'll give a few examples of how that is the case. So just going back to the concept of the framing and the central thread of the plan, which are aging, equity and inclusion in aging. We have a central concern for aging, equity, inclusion, and accessibility. So in the plan, and it's important, I mean, a plan can say, oh, yes, we're in support of this and we oppose that, but really taking a stand and putting it on paper is key. And you will see when the plan comes out that we are very supportive of diversity, including older women, people of color, the whole list that we had talked about before, members of the LGBT community, folks with disabilities, the justice involved, rural and lower income. And we very openly state in the document in black and white that we oppose the intersecting oppressions, including racism, gender discrimination, and so on, including ableism, ageism, xenophobia, and transphobia and homophobia. So those are specifically called out in the plan, and I wanted to point that out. I am pulling out specific information, and it looks really like a very busy slide, but it's sort of intentional. As I was doing this, I thought, well, I could distill this down, but no, I think there's something to be said for seeing an excerpt of what is very likely, because the plan is in the final draft as of today, of what is in there. And so to see really how we phrased it, what's in there, and to move forward from that perspective. So I won't read all of this, but I want to say that the strategies and actions are based on data. Our partners at the University of Illinois are just amazing at finding data and distilling it and disaggregating it, and to get to the point where we understand really what we're looking at and what we're doing and where we need to focus. And so one of those pieces of data focuses on LGBTQA plus older adults and functional limitations, as well as the many groups, including LGBTQA folks, who feel that they have significantly lower self-rated health than others. So that is data, and that's data we're going to be following. Within the plan, we are going to include data tracking, data dashboard, that is, as well as implementation trackers. So we're accountable. We need to be transparent and accountable so people can see, are we doing what we said we're going to do? I am, I, of course, am hesitant with the budget situation that the federal government has imposed upon us and the constraints that puts on the state government, but it's a 10-year plan. So we're going to start with where we can start and keep moving and build momentum. And by sheer collaboration and coordination, what I've already been so impressed with is all the things we can do just by coordinating and breaking down some of those silos. So I just want to, again, pull out a few of the actions that you'll see in the plan regarding age-friendly. We want to conduct a statewide baseline assessment of Illinois to ensure that it's age-friendly and focuses in the area of greatest need and populations of greatest need. That we focus on actions on housing stability and security. And we're going to survey state agencies to see to identify the inventory of housing and where their policies, programs, and investments are relating to different groups. Of course, I want you to recognize that the LGBTQA plus communities are well represented in these, specifically in these plans and these actions. These were not added later, these are there. With respect to transportation, identifying service gaps and barriers for older adults of all groups, and looking at inequities and how do we address that, including for individuals with disabilities and their caregivers. Access to care. Senator Collins, I thought, put it beautifully with respect to the need for training and addressing disparities in healthcare, and is how that is so critically important, that well-meaning people do things that can hurt. And so looking at how do we address the disparities in healthcare as well as the training aspect, which brings me to this specifically. There is simply just not enough information provided in health professions education that addresses the needs of older adults and ensures that there's equity and inclusion and attention, and that we're not discriminatory in our practices. And so I'm delighted to say we are working with the Illinois State Board of Education, the community colleges, the extension programs, pretty much anyone who will slow down long enough for us to catch them, to engage them, will be part of this plan. And to the conversation, to the person, they have been so supportive and saying the time is right for this. Everybody is interested in breaking down the silos and bridging gaps. With respect to caregiving, we're looking to establish a caregiver council. You know, not all of these things will happen right away. Some of them are going to take time, but they are specifically, very explicitly indicated in the plan. And with respect to affording aging, we're going to compile and analyze the information that comes into the resources that we are aware of, such as the senior helpline. What are people asking for? What do they need? And disaggregating this by different groups, by race, by sex and gender status, by disability, geography, etc. So I want to ask all of you, what does the MPA mean to you? What do you hope to see change as a result of this plan? And my next question is, how are you going to be involved? Because this isn't just the Department on Aging. The department does incredible work. I've been nothing but profoundly impressed by the sheer will and dedication of everyone in the department and the whole aging network, the AAAs. But it's going to take everyone. This plan impacts everyone, so everyone has to have some skin in the game, so to speak. So I do hope that you will take up the call to action and be part of it, become part of an action group, be an ambassador, talk about the plan in your networks and share messaging. We'll create the content. We'll make it easy for you, because I know sometimes doing those social media posts are not easy, but we'll provide all of that to you. And we hope that you'll engage your organization, your networks, and your community in this work. So with that, I thank you and really look forward to working with each and every one of you as we roll out this plan over the next 10 years.
Thank you so much, Michelle. And I encourage people to respond at least to that first question in the chat. You know, what do you want to see change as it relates to aging in Illinois? To give Michelle a little data as we wrap up, additional data, because you've been collecting data as we wrap up the year. And if there are any questions, please put them in the chat for us. And now I am gonna hand things over to Ray, one of our storytellers from Storytelling for Change.
Good
Michelle,
morning,
you can stop
everyone.
sharing.
My name is Ray, and I'll be 78 my coming birthday in January. And I'm here to share a story about home as community. My childhood homes were often very uncomfortable places, both physically and emotionally. Too many disruptions. My mother Doris had me when she was 15, and I was raised primarily by her Aunt Winnie, who also raised Doris because her mother was institutionalized with mental illness. I recall 5 different addresses with 4 to 9 people crammed into small quarters. When I was about 15, I was in a small bedroom in a rooming house over a restaurant. I lived there until I was about 20. Home, that comfortable place to be, became neighbors' homes, friends' homes, church, and anywhere else I could get away. Don Tolley was my best friend for years, and Don was part of a gay rat pack at Hammond High School. Don was a blonde-haired pretty boy, nothing ever sexual between us. We were besties. Once when I was having a difficult time, Don's family let me stay at their home while they were on vacation. A couple of years after graduating high school in 1966, Don moved to Chicago. I loved visiting Don on the weekends, spending time with my friend and exploring gay Chicago. A couple of years later, I moved to Chicago. Oddly, I didn't see Don very often. Our lives moved in very different directions. But fast forward to the late 70s, and one day I ran into Don while shopping around Clark and Diversey. I was surprised and happy to see Don. However, the look on his face and his pale appearance told me something was not right. Don told me that he had just left the hospital and was told they could not diagnose his condition. We stayed in touch for a short while, but then my calls went unanswered. Then I heard through a mutual friend Don had died. I was too emotionally wrecked and didn't ask about or attend Don's funeral, a regret I live with today. The news of GRID, gay-related immune deficiency, was everywhere. Throughout the 80s, conversations in gay bars changed from "what fun are you having" to conversations about "who have you visited in the hospital and who has died this past week." I started drinking more heavily. I seldom went out and spent much of my time in social isolation, drinking alone to bury my emotions. In June 1990, I was diagnosed HIV positive, long-term non-progressive. My life soon became 2 different versions of Ray. The Monday through Friday Ray with a successful career in information technology, and the weekend Ray, drinking and using other substances and seldom engaging in the gay social scene other than to find sex. Then one day I hit a wall and wanted to end it all. Rather than acting out, I went to my doctor and told him about my suicidal thoughts. And he talked me into going into Illinois Masonic Clean Start. That was September 4th through the 13th, 1991. My first few days were on suicide watch. Following the hospitalization, I did attend 12-step recovery meetings, but was still very troubled. I was not sharing my feelings, especially my fears. I relapsed. On August the 12th, 1992, I returned to my doctor because of occasional hand tremors while writing. His immediate question was, "Are you drinking again?" Alcohol was interacting with a blood pressure medication I had recently started. I left his office with a prescription for Antabuse, which makes alcohol poisonous. I went to my regular recovery meeting on August the 13th, 1992, and cried like a baby and sobbed, "I want what you have," and I have not had a drink or a drug since. A friend, Angel, who invited me to do some volunteer work for Open Hand Chicago, where he worked. I was soon a floater, riding along and delivering meals to people living with HIV and AIDS, and I later maintained their donor database. Some years later, Angel's partner Bob called. "Angel is very ill and wants to see you." I went and sat at his bedside, and we recalled our open hand experiences, and he told me how grateful he was for my friendship. When leaving, I sat in my car, screaming and crying before driving home. The next morning, Angel, a true angel to so many, died. I was also part of a crew that cared for our mutual friend Henry. We were committed to supporting Henry's request to be in his own home until he took his last breath. We cleaned his house, shopped for groceries, got him to appointments, and whenever possible, just sat with him and listened to his stories about traveling the world. Beijing, Ethiopia, Kenya, Egypt, and the Virgin Islands. Henry died at home, May 16, 2010. I have had 2 physical homes in the past 45 years. Obviously, the bouncing around I did in my younger years formed me into a person who had to plant his roots. My emotional and spiritual homes have involved me in several organizations. Each is a safe space in which we can gather, nurture, and support each other, sharing with clear intentions both our struggles and successes. One of those is Adoti Chicago, an international, organizational, and intergenerational group that offers affirming experiences and loving gatherings to foster emotional, physical, and spiritual well-being for same-gender loving men of African descent. I've attended summer retreats since 1994. 12-step recovery is another. I've been clean and sober for 33 years and still attend 3 meetings a week, supporting others and myself in maintaining a healthy attitude of gratitude. The Mankind Project supports a network of peer-facilitated men's group where men mentor other men through their personal passages in life. There are several others that time does not allow me to mention. However, Don, Henry, Angel, and many other people and organizations have held together the broken pieces shattered by circumstances and are the threads woven into my beautiful, resilient fabric of my life. I have strength to resist and defend my homes against any challenges manifesting in my life. I have gratitude for each day that I awaken, knowing that I have intention and can face and embrace and appreciate each day. Thank you. Thank you very much.
Thank you so much, Ray. Billy?
Yes, Ray, I just have to thank you on behalf of everyone on this call. I'm filled with gratitude myself from listening to your story. As a matter of fact, I'm honest, I was in tears. Your story really touched my heart, as it did, I'm sure, everyone in this room today. So thank you, thank you, thank you for sharing your life and story with us. I can't thank you enough. I just need to take a little minute here, if you don't mind. Whew, that was very compelling. Um, my name is, good morning, everyone. My name is Billy Rogers, and I'm the director of Golden Rainbows of Illinois South and serve as the Illinois LGBTQ older adult advocate for the Illinois Department on Aging. It is my pleasure to moderate the Economics on Aging Challenges and Opportunities panel. I will briefly introduce the panelists in the order that they speak. Each will provide an opening remark, and if time allows, we will open the floor for a short Q&A. Diane Slezak is the CEO of AgeOptions and will speak about federal funding and the Older Americans Act. Elizabeth Durkin is the Manager of Healthcare, Education, and Counseling at AgeOptions and will provide an update on the impact of H.R. 1 on Medicaid and Medicare. Starr De La Santos is Associate Director of Coalitions at Women Employed, will talk about proposed family leave legislation in Illinois. And finally, we will hear from Nia Kelly, Director of State Legislative Policy, Equity, and Transformation at Chicago Coalition to End Homelessness, who will talk about the changes in federal housing policy and its impacts. Okay, Diane, take it away.
Thank you. I am still dwelling on Raymond's story. It just was a lot to take in. So asking anyone to speak after him is a tough row to hoe, just hard to switch gears. You brought me back, Ray, to back in the early 80s. AgeOptions had a staff member who was later we discovered probably suffering from AIDS and passed away. And it was a staff member where all of us knew that he had come out and he was gay, but his family did not know. And so we tried our best to support him. He kept taking sick days because they couldn't diagnose him. And finally, he passed away. And all of us went to the funeral. And on one side of the funeral home were his coworkers and his friends in the gay community. And on the other side was his family. And it was just really, you just brought me right back to that funeral home, which was so tough. So sorry to segue with that, Billy. Okay, here we go. So I am here to talk a little bit about, I have been reflecting recently as the year comes to a close on everything that we have been through during 2025, starting with a series of surprising executive orders at the federal level that put dents in Social Security, the Older Americans Act, the administration, and then the creation of DOGE, which basically threatened to decimate and did partially cripple the administration on aging. And there was a great threat that we fought off together with many of my colleagues who are on the phone with a lot of advocacy to dismantle the Older Americans Act programs and separate the nutrition programs from the social services programs and put them in two separate departments at the federal level, which would have made administration of these programs just almost impossible. I won't go through all of these. HR 1, we're going to talk a little bit about more later. HR 1 is what some of you know as the big, beautiful budget bill. And finally, we just lived through the longest government shutdown in history. And we're hoping that by January 30th, we have another budget bill that passes. And but we're still waiting to see if that happens or not. It looks like they're going out on recess in Washington very shortly. So next came the next and combination attacks on DEI. And our aging network in Illinois, under the leadership of Mary Kilo, who I think is on the phone, and my colleagues at the area agencies, have stuck to our mission and our vision. In some cases, we've changed our language, but our dedication to DEI and to helping people who are most in need has just remained very stable. Finally, most recently, ICE has had a terrible chilling effect on many of our communities. Even our Arab American and Chinese dining sites have felt the effect of ICE with some diminution in attendance. Thanks, Elizabeth. So just to go back, the current situation that is in mid-November, Congress passed that spending bill to end the longest government shutdown. We had 3 appropriation bills that extended us a little while. And now the next slide. So what we have in front of us right now, and if you go to the AgeOptions advocacy site, you'll see this detailed, but basically it is likely we will have very flat funding. a $4 million boost under the Supportive Services title of the Older Americans Act means a little less than 1% for suburban Cook County. So this is so little money across the nation that it doesn't begin to keep up with the growth in the population. A $2 million boost to caregiver programs would be very great to have. We want this budget bill to pass, but again, it really equates to about level funding because of the huge increases in the older population. Every day, 12,000 people turn 65. So the growth in the population and the demands of increasing costs at our congregate dining sites, the cost of food, the cost of staff members, et cetera, make this really a difficult time. Next slide. So the other issue that we're working on, but has fallen a little bit into the background, is the reauthorization of the Older Americans Act. So reauthorization of the act is overdue. We have gone through many periods like this over my decades of service. So, we're now pretty secure that we're going to continue with the Older Americans Act, that it will be reauthorized. Over the past 60 years, it has always had bipartisan support, and we are hopeful that the act will pass again, but we're even more hopeful that the budget bill will pass. So please do visit our website. I think I have a link to it in one of these slides, maybe the next slide. So state advocacy, the good news here is that we live in the state of Illinois, and we are so grateful for the support of the Department on Aging and the General Assembly and Governor Pritzker, having one of the best governors in the United States, who has really supported older adults and caregivers in particular. So here are some of the high points. We are advocating for increases, also knowing that this is going to be a very tough year, but if you don't advocate for increases, you might not even have level funding. So we just recently got approval to hold a Capitol Springfield Rally Day on February the 25th. So we'll be gathering older adults in our advisory councils and anyone who is interested, and we'll be getting a flyer out on that soon, but we just received approval to do that recently. So next slide. So our key focuses that I've already mentioned going forward are, please check out our advocacy website to look at how you could support. It's very easy to click and send a letter send a letter to your congressman to support the funding for the Older Americans Act, and even to support Medicare funding and several other issues. So please, the link is right there, the ageoptions.org advocacy website. So the other point that I would like to make, we can switch to the next slide, is that it's really important to remind people who delivers these services. That they're delivered through the Older Americans Act. Many people attend their dining sites and have no idea that the funding comes through the Older Americans Act. So it's really important to keep that message coming through, that all of you on this call have helped to advocate for older adult services. And it's really important to remind people that the services that they're receiving come through funding at the federal level from the Older Americans Act, but from the state of Illinois as well. So I recognize Mary Killow and our former director of the Department on Aging, Paula Basta, for their leadership. And also on the call with me are my terrific colleagues, Marjorie Moore and Becky Salazar, who lead area agencies downstate. So thank you for all of your support. And we'll go on to my colleague and fellow staff member, Elizabeth Durkin, to talk to you about other federal programs right now.
Good morning, everyone. I am realizing that I have been tasked with talking about Medicare and Medicaid before 10 o'clock in the morning. Can people see my video? I'm sorry, I'm just checking because I can't see everything on my screen.
We can see the slides,
Great.
yes.
Okay. Yeah, so without too much caffeine and this early in the morning, it can be hard to get through this material, but bear with us. Diane referenced what we referring to in this panel as HR 1. So this was the budget legislation that was passed in the summer. And it brings sort of sweeping changes to America's healthcare system, really. It is the largest ever rollback of health insurance coverage, federally funded health insurance coverage. And it involves the largest cuts to federal dollars going to state budgets for healthcare. So it's a pretty substantial piece of legislation. I just want to make one note that there's a lot of different terms that apply that people use for this legislation. So during the debate on it, and passage, it was celebrated as the One Big Beautiful Bill Act. It is also sometimes called Public Law something something. I'm sorry, I've forgotten the exact number, but if you're hearing people talk about the budget and they're saying Public Law something, that's this. And then also the Trump administration has recently rebranded this due to its unpopularity as the Working Families Tax Cut. So that's new language. And if you see that language, it's applying, again, to this piece of legislation. So the impact on Illinois kind of top line in terms of healthcare spending is that this legislation reduces access to, reduces access to healthcare. And it does that through like a number of different strategies. There are multiple categories of lawful immigrants who coverage is being taken away from. I'll get into that in a little bit more detail. It also adds new eligibility requirements to make fewer people qualify for Medicaid or also for the marketplace and Medicare. It adds burdensome paperwork requirements so that people who are eligible can't get coverage. And in a few years down the line, it's going to add some cost sharing for Medicaid so that people will bear more of the burden themselves. And we know that when people do have to face those cost shares, they often reduce their healthcare use since they can't afford the $300 copay or whatever it is to go to the emergency room. And it also reduces marketplace plan subsidies. And that is something that is in the news a lot. Everyone's paying attention to. I won't really be directly addressing the marketplace today because I've got 6 minutes. I can't do it all. So in terms of Medicaid, just top line, the Illinois Department of Healthcare and Family Services is estimating that the impact of this legislation on Medicaid in Illinois over the 10-year period is that 300 to 500,000 Medicaid customers could lose coverage, and that the state will lose almost $60 billion in Medicaid funding. And so that is pretty substantial. For the purposes of today's talk, the one piece of good news is that the group of adults that are most protected from coverage loss are actually those who are enrolled in the AABD category of Medicaid. So that's individuals 65 plus or those with a qualifying disability. And so their Medicaid coverage is going to be ongoing, and the bill doesn't reduce or eliminate their coverage specifically. But the reduction in dollars, in federal dollars coming to the state, may force the state to consider cutting what are called optional services in Medicaid. So according to the original Medicaid legislation, there are certain kinds of healthcare services that all states are mandated to provide coverage for in the Medicaid program. But there are a long list of optional services that states can choose to provide or not. Many of those are provided in Illinois. They include things like dental, vision, prescription drugs, and community-based services. And those we're concerned may be negatively impacted due to the budget constraints. So I have two charts here, and in the interest of time, I'm going to kind of top line them. So for the Medicare program specifically, this legislation kind of limits its impact to changes in immigrants who can be enrolled in the Medicare program. So there were a number of legally authorized to be here immigrant categories that have been eliminated. And so the remaining non-citizen categories of Medicare eligibility are legal permanent residents, Cuban Haitian entrants, and those residing under the compacts of free association. So Medicare is no longer accessible to lawful immigrants who don't meet these categories. That is effective as of the signing of the bill. However, existing Medicare beneficiaries within those immigration categories can stay covered for 18 months from the time that the bill was signed, but they will be losing their coverage in what is essentially about a year from now. In terms of immigration restrictions on all categories of Medicaid, they have been similarly restrained, but that provision does not go into effect until October of this coming year. So those immigrants remain covered under Medicaid for the next 10 months or so. Then under our other Medicaid coverage categories or specific Medicaid coverage categories, again, in the interest of time, I'll just say it's going to be more cumbersome for people to become eligible, more cumbersome for them to remain eligible through the imposition of new restrictions that will be beginning at the end of 2026, going into coverage to begin in January of 2027. Again, these are all ways to try and keep people from being in the Medicaid program. And then this cost sharing that I referenced will come into effect in October of 2028. We also have some state funded programs in Illinois that are not federally matched. And one of those in particular is the Health Benefits for Immigrants Seniors program. The legislation doesn't directly address these kinds of programs, but because of the threats to the state budget, we do have concerns about them. And then finally, just in general, we are also concerned about not older people, but younger people who care for older adults and adults with disabilities, and how the increased stress on those individuals due to these changes and threatened loss of coverage may ultimately end in an increased burden on caregivers and their inability to keep their loved ones at home anymore and place them in nursing homes. So that is another concern. Additional resources, as we know, these slides are going to be shared, and my contact information. And I appreciate your attention. Thank you.
All right. Hi, everyone. My name is Starr De La Santos. I'm the Associate Director of Coalitions at Women Employed, and I'm here representing the Illinois Time to Care Coalition. So I'm going to go ahead and share my screen. Fabulous. Okay. And I really just, I go by she, her also, and I also am the secretary of the LGBTQ Advisory Council for the city. And honestly, I really wanted to just start off with, again, thank you, Raymond, for your story. I was also in tears myself. And it's also just a testament of why I do the work that I do. And while, there has been so much progress that has been made, there is still so much more work that we need to do. And this is why I am personally so passionate about paid family medical leave, especially because of that story. So again, thank you for sharing that. So to get into it, again, that's me. And I work for Women Employed. Women Employed is a nonprofit in Chicago that represents all of Illinois, has been around about 53 years now, really working towards affecting policy change, expanding access to educational opportunities, and advocating for fair and inclusive workplaces so that all women, families, and communities can thrive. We have done a lot. I don't have enough time to go through it all. But again, I haven't been around for the entire 53 years, but I've been around for 4. And out of the 4, we've worked tirelessly on, salary transparency, paid leave for all workers act, ending the sub-minimum wage in Chicago, And we're not stopping. And there has been so much more progress that has been made way before my time. And so this is why I really, thank my seasoned folk, because without you all, I wouldn't be here personally. I wouldn't be here presenting to you. I wouldn't be here doing the work that I do. And it's all because of the people that came before us. And so the Illinois Time to Care Coalition, it's all about paid family and medical leave. So we're talking about long-term care, not short-term care. And I'll go really quickly into the differences between the two. But since 2020 in particular, we has led the Illinois Time to Care Coalition, which is a group of diverse stakeholders. I'm adamant. My coalitions need to include everyone that's impacted. I want it to be as diverse as possible. So when it came to this in particular, I was very adamant about, having LGBTQ plus organizations represented, right? Because especially with Raymond's story, chosen family, it's so important. Not talked about enough, honestly, but everybody has a chosen family. And I think it's just more, just because of the discrimination and I myself, I'm not really close with my family either, right? And so I really count on my friends, my chosen family to, call and take care of me. So I was really adamant that this coalition really included all the various advocates, worker centers, the disability community, everyone to really, because again, this is a human issue, period. It impacts everyone. And we don't talk about it. I myself am a caregiver. We didn't talk about this. If you would have asked me 10 years ago, would I be a caregiver to my mom? I would have been like, what? What's that? What do you mean? Like, I have no idea. We don't talk about this. We don't talk about it enough. And so I am also very adamant in talking about it. Like, let's talk about care. I need care right now. You might not know, but my back is in pain right now. And I'm struggling, right? And it's like, it can happen from one day to the next, from 1 hour to the next. Our health can deteriorate in seconds, and we need the care. So what is PFML and why we're fighting for it? So again, Illinoisans need paid family medical leave. So again, we do have FMLA, which is our federal medical leave, which is unpaid, but guarantees that you have your job back at least, right? In Illinois, we do not have a long-term care. We only have short-term care. And as we saw during COVID, for example, as we're even seeing now, as people are still being impacted by COVID and still have health issues, individuals need time off. Individuals need to be able to take time off, and individuals need job security. And I see it all the time. There's this mentality of like, I have to go to work. I can't lose my job. I can't do this, because that's what it is. That's the reality. If you're sick, if you're in pain or whatever, the employer even expects that. And so we also have to kind of change that culture with the employer, right? Like, you don't need to give your last ounce of everything for a job, right? You need to be 100% in order to give 100%. And so how does this really impact our aging LGBTQ community? Well, there's a large population of older adults in Illinois in particular who are 50 and over, about 1/4, and they face continuous disparities. And again, you think about years and years of lower lifetime earnings. You're not able to save for retirement. You rely on your chosen family. You have housing instability and healthcare barriers just because of how you identify. Look at all the attacks on gender affirming care right now. It just compounds itself as time goes on, right? So me at the ripe age of 36, I know I'll be struggling with these things. I know that it's going to take me time to catch up. So by the time I'm 50, I can only imagine, right? And so that's why, again, this work is so, so important to me in particular. I think about, also retirement homes and the discrimination that our community faces in retirement homes, for example. So that's why, something like paid family medical leave will help alleviate more people going into those retirement homes and being discriminated against and treated poorly, because you'll have your chosen family, or you'll have your family being able to take care of you, or as a community itself, because that's what it really is. As a community, we all kind of take care of each other because we know that we will provide the love and care that we each need. And so our paid family medical leave program, again, different from the short term. The short term right now goes, we have the Paid Leave for All Workers Act that gives you 5 days of time off for any reason whatsoever. Whether you're part-time or full-time, it's just different of like how you accumulate it. Chicago has 10. So 5 sick, 5 for any reason. Okay, but there is still no long-term care. So while I can take 5 days off, I could probably go off with 10. I know, unfortunately, someone who was on FMLA. We don't have that wore out, that timed out, and then they fired her. And then they said something, and it was all about gender affirming care. And I heard these people say, well, we can't hire any more they thems. And I was just like, what? What I said was, probably not proper for this recording. But some words were had, and it just fired me up even more to continue this work and to prove to people and kind of call them out, because at the end of the day, everyone deserves care. It doesn't matter how you identify, it doesn't matter your gender, it doesn't matter your age. Everybody deserves care, and these employers also need to be held accountable for the type of culture and the type of mindset that they're kind of like pushing forward. And with our bill as well, we have an inclusive definition of family. There have been other iterations from other people who have taken that out, and we put that in, and we're not backing down. There will be an inclusive definition of family, period. So what are the benefits? Again, the benefits are really the ability to age in place with your loved ones, with your partners, your friends, your community members. A reduced financial strain during a medical crisis, because it will be paid, right? And again, like you shouldn't have to think about healing and having to pay for rent. You shouldn't have to think about recovering and having to pay for food, or losing your home, or losing your job. That's just going to cause more stress, and it's going to deter you from healing, right? It's all mind, body, soul, all connected, right? And so if my mind's not right, my body's not going to get right either. For caregivers, especially, it helps prevent burnout. Being a caregiver is hard. I know it from experience. It is hard to take care of someone, who's also set in their ways, maybe doesn't, want to, my mama's tough. My mama's tough. So I'm like, don't drink the Coca-Cola. She's going to drink the Coca-Cola. Sometimes, it can be, a back and forth. So it also gives you the ability to just kind of take that breath and take care of yourself, so you're able to take care of others. And so in short, paid leave really strengthens both caregivers and those receiving the care across generations. And so that's just a little graphic, again, the difference between long-term and short-term care. We have the short-term, we do not have the long-term. These are all our incredible partners that we couldn't do all this work without, and who, again, are working tirelessly in help and ensuring that something like this is passed. These are some of our coalition principles, again, just ensuring that we have an inclusive definition of family, that it applies to all people, all working people, and it provides a decent amount of weeks, not just 5 days, just not 10, but a good chunk of time. So how can you help? How can you join us? I will be sending in the chat momentarily a sign-on letter for organizations and individuals. This is really to go to Governor Pritzker, because we do need $50 million of seed money that will be paid back to the government in order to start us off. But we do have that going on. We have a teach-in coming up. We have a lobby day on March 25th that I'm happy to share more information about. Share your story with me. That's another way, like Raymond shared his story today. Like, share your story. More people need to know how this impacts everyone, how it impacts people from all diverse populations. Speak to your policymakers about it. If you have an informational session or anything you want me to join, I'm happy to do that. Or you can connect with me directly or scan the QR code to visit our webpage. But thank you again so much. I know I sped through this, but again, if you have any questions about paid family medical leave, please let me know. And thank you all for taking the time today, even if it was early in the morning, because it shows how important this is to you. And that gives me hope that we can move all of this forward. So thank you.
All right, I will go ahead. Thank you so much, everyone who has come before me. This has been such an amazing experience to hear and bear witness to the work that is being done, the work that has been done, and the shoulders that we stand upon today based on the advocacy over the last 40 years. My name is Naya Kelly. I'm the Director of State Legislative Policy, Equity, and Transformation at the Chicago Coalition to End Homelessness. And with the time that I have, I'm just going to go ahead and jump in. Um, by chance, last night I was watching an old episode of A Different World. If anyone remembers that show, it's kind of amazing. It's kind of one of those things I put on to kind of just, get my mind off of the day. And the episode I was watching, if you're a fan of the show, was when they were in some sort of social justice class, and Ron was talking about homelessness and how everyone just needs to go get a job, like go work at McDonald's and then eat there, and everyone's like pushing back on it, and then he ends up running into the old restaurant owner of his favorite restaurant, who was now experiencing homelessness and was elderly. And he was experiencing homelessness because he had gone to take care of his mother, as she was dying, and the medical bills just piled up to the point that he now experienced homelessness and was elderly. So I thought that was like perfect timing in terms of preparing myself for this space. Um, Understanding that a lot of us, are going to witness our parents, our grandparents, our aunts, our uncles, our siblings, ourselves get older, and the safety net that has been set up oftentimes contains a lot of holes in it, and people fall through purposefully. Like this is purposefully set up in a systemic way that allows us to throw away people that we find to not be useful anymore to our society. We are, in this moment, in this like intersection of time, we are seeing the federal government actively decide that, they're going to make cuts to Medicaid and Medicare, to SNAP, to vital programs across the board. And I believe Michelle brought up what is happening at HUD, and I'm going to get into that a little bit as well. But as Raymond spoke, I also want to acknowledge that as we talk about the people who are here, there is a generation of people who are not here because of decisions made in the 80s and the 90s, that saw people as, again, throwaway, and those people should be here. And they should, for community to grow old, to see their families, to see their children. And so just acknowledging that, and that we are currently in a disabling event right now in terms of COVID, and the research is showing us more and more that it has a lot of similarities with HIV. And what does that mean in terms of aging populations? So just some data that I wanted to share with you all. 5 million Americans are living below the poverty line right now. People who are over the age of 55. 2.35, and that's them making less than $15,000 a year. So we have 5 million Americans living and making less than $15,000 a year. 2.35 million are house burden. For folks who don't know what house burden is, it means that they are using half or more than half of their income in order to stay housed. In the point in time count, back in 2023, we saw that 20% of the people who were counted were elderly, and that's about 133,098 individuals. One in four of the older adults, one in four of older adults are experiencing homelessness. The numbers continue to grow. In the 90s, it was about 11%. Right now, it is at 50%. It could be that there was an undercount in the 90s, but in that we're doing a better job, but that number is um, just is jarring. And in terms of monthly income for our elderly population, their income ranges between $553 to $943 per month. And we are at $7.3 million short in terms of units in this country. And so hearing all of that, I think about our shelter systems in which, if someone is experiencing homelessness and attempt to go into shelter, some of our shelters are not ADA compliant. So people who are using wheelchairs, people who are using mobility aids may not even be able to step into the door of shelters. We have, here in Chicago, you can you can call 311 and they're supposed to they tell you to go to your local police station or your local emergency room. Getting there is like if you have mobility issues, but sometimes what we've heard is that people who are wheelchair users, the person that they send to pick you up is in a vehicle that people who are in wheelchair and need mobility aids are not able to get into. So their choice is to continue to sit there and wait or to try to figure out some way to get their wheelchairs into the vehicle and then maybe dropped off at a shelter that doesn't have access to that they can't access because there is no ramp. Shelters may not be able to provide refrigeration if people have medications that they have and need to have refrigerated. It is in thinking about affordable housing, or if they are able to get into housing, they may need an elevator or they may need a building with an elevator. The unit that may be available is in the basement, which can be cold and, can be humid and really flare people's conditions. And so I'm often asked or told that in my work that, there are just some people who just don't want help. And I ask the question, well, what kind of help are you attempting to provide to them? If it is not meeting them where they are, then is it truly you providing assistance? In terms of what is happening at HUD right now, there was a NOFO that was put out a month and some change ago, which was strange in the sense that it came out extremely late, and it was not needed. We had the last Congress had provided 2 years, that HUD had 2 years to in this cycle, but they cut the contracts off and said we're going to do a new NOFO. And so in terms of doing that, we saw that, oh, it is 10 o'clock. I'm so sorry. I've talked so much. My apologies. Kim, do you need to cut me off? I can stop talking. I will.
You go ahead and wrap up. We're recording. I let the people know we're going to go over a few minutes, and if they have
Yeah,
to go, no
okay.
worries.
I'm so sorry.
No, sweetie, you're fine.
Okay, so in terms of what happened, we saw the executive order that came out in August that wanted states and communities to move away from housing first models. Housing first models say it's exactly that: get people into housing and then provide them with services. Instead, HUD is now telling communities that they need to look at transitional housing and that it has to be tied to services. It also is working to criminalize and institutionalize people who for experiencing homelessness, and so wanting them to pass ordinances at the municipal level that, if you were experiencing homelessness, you can be fined and you can be incarcerated for experiencing homelessness. The NOFO moves away from permanent housing. The folks who are using permanent housing include veterans, families, elderly folks, people with substance use disorder, people who have mental health issues. people who have, mobility issues or disabilities. And so we are, they have taken the NOFO back and they said, just kidding. We're not going to go forward with this, but we're going to put something else out. But it is going to, that means that we don't know when money is going to come out into communities, and it is flipping everything on its head. Upwards of about 8,000 people are at risk in Illinois of losing housing, with a 115 million dollars in funding for permanent housing lost. There's lawsuits right now that Illinois is a part of, and there is a hearing tomorrow with pulling the NOFO. The federal government thought, oh, this case can go away now. And the judge said, who do you think you are? And so the case is continuing. We're unsure of when a new NOFO will be published, but we are doing everything in our power to ensure people who are in need of permanent supportive housing have access to it. We need additional units, and the fight continues. This is not over. It feels sometimes like we are being buried in atrocities from the federal government, but we will continue to fight and we will win. Thank you.
Wow. Um, you, the power in your words. Thank you. Thank you, Naya. Thank you to all of our speakers. Thank you to those who were able to stay on just a few extra minutes. We really appreciate you. We have a recording that we will share with everyone. We're going to also share the slide decks. We'll share any links that were shared. Ayanna, you can put the link to the uh, post-event survey in. Feel free to open that up, as you can add questions to our survey as well, because we gave you a lot of information and you probably processing. So no worries there. Thank you to everyone for providing your expertise and your time to speak with us today. Thank you to all the folks who are in the audience. It has been a rough year. I think that goes without saying. So I'm hoping this holiday season, each of you is able to find moments of rest and joy and restoration. As you see, there are many opportunities to engage in advocacy. You don't have to do it right this second. Let us all get the rest that we need. And we will see you all in the new year. Thank you, thank you, thank you.